Yep, my heart's beating all right. But this doesn't still answer the question, am I going to have a heart attack? Do I have cardiovascular disease? Oh, I don't know. There's lab tests. Let's discuss those. Hi, I'm Dr. Michael Berglund, and today we're going to be talking about alternative ways, besides cholesterol, to test if you have a high cardiovascular risk. Some people might go, well, there aren't any other ways. Aha, yes there is. I'm talking about things like ferritin, which is the body's storage iron. How does that affect it? Iron is an oxidant. Did you know that? I had no idea iron was an oxidant. It is. And one of the problems with cardiovascular disease is that there's a lot of oxidative damage caused by free radicals in the system. And so that's one of the benefits of having antioxidant therapy. It helps prevent things from damaging the arteries. That is fascinating. Well, how did I get too much iron in my system? Well, we don't know that. But sometimes it's a marker of inflammation, and sometimes it means you just had too much iron in your system. Gee, Dr. Berglund, please tell me more. The other ones that we can use are C-reactive protein. C-reactive protein is also a marker of inflammation. This is a common test that's done for people that have rheumatoid arthritis or lupus, and it generally marks like what's your level of inflammation within your system. But it also works very well for cardiovascular disease risk. The other commonly linked thing with heart disease is gingivitis. Your gums are actually a bunch of capillaries all stuck together. That's why it's really pink. Okay, it's a bunch of blood in your, that's what it is. Isn't it possible that the inflammation that's going on there is also the same inflammation that's going on here? Well, I have a lot of gingivitis problems. Maybe I also have cardiovascular problems. That's useful. The last thing that I want to discuss is something called heart scans. It's a CT scan or a CAT scan. They're measuring calcium that's in the vessels of the heart. Okay? Because one thing is that CAT scans do, they're just basically x-rays, and x-rays measure bones, right? So calcium is what bones are made of. So if there's a certain amount of calcium in the heart, they extrapolate that information to go, oh, so if you have this much calcium in your heart, in the vessels of your heart, and they're doing it in layers, they go, you have a score of this. And they'll be able to determine, based on the population at large, where do you fit? I mentioned quite a few tests. There are even more, especially by alternative practitioners. If you're interested in knowing what your cardiovascular risk is from a broad spectrum, I encourage you to find some doctors that do that kind of work. And look them up online. If you find the lab, you might actually say, well, which doctors in my area do you work with? And you'll find a doctor that does that kind of work. Thank you for watching my video. I encourage you to come back. We'll have plenty more videos on common sense medicine.